All right, welcome to the integumentary system. So this week we'll be talking about the integument and all of its accessory structures. Well, actually, this week we're only going to be talking about the integument, but in the next week we'll continue on with the accessory structures of the integumentary system. So the integumentary system, it is your skin, hair, and nails. Skin being the cutaneous membrane that is the main component of the integumentary system, and the accessory structures being that hair and nails and all of your various glands that lie deep inside of your integument. Your skin makes up about 16% of your body weight. So if you're in the mid 100 range as far as your body weight is concerned, about 20 pounds of your body is made up of skin, which is pretty crazy. It acts as your first line of defense against everything that you encounter in the world, so things like chemicals and bugs and microorganisms that want to try to invade your body. Your skin is there to protect you. The skin is highly vascularized and innervated, so there's a lot of blood supply, there's a lot of nerves. The three parts of the integumentary system are the epidermis, the dermis, and the hypodermis, which is also known as the subcutaneous layer. However, that being said, the hypodermis is not actually part of the skin layers itself. It's usually thrown in there, but it's not actually part of it, so we'll talk about that. The functions of the integumentary system itself. So, protection. It protects us against impact, abrasion, fluid loss, and any chemical attacks from the environment. It also helps with excretion of salts, water, and wastes that are trying to be excreted by your body. The maintenance of body temperature by insulation and evaporative cooling. We also produce melanin, which helps to protect us from UV radiation. It produces carotene, which helps to prevent abrasions, and it repels water. It synthesizes vitamin D, which not only gives us strong bones, but it's needed for calcium metabolism. It helps to store lipids, which again helps with insulation. It helps with detection. So with all of that innervation comes our ability to sense touch, pressure, pain, vibration, and temperature, which is all sent to the nervous system for processing. And then we have a coordination of the immune response. So helping to send out white blood cells to attack pathogens and cancers. So first let's talk about the epidermis. The epidermis is the most superficial layer of the skin, and it's a keratinized stratified squamous epithelium. So remember, stratified squamous means that there are several layers of flattened cells. Keratinized meaning that it likes to be dry, and it has a lot of keratin in it, the protein, that helps to waterproof or water resist our skin. The epidermis is avascular because it is an epithelium. Your skin can also be thick or thin depending on the region in which it covers. So thin skin will be on most of our body surfaces. Thick skin, think more of our hands and the soles of our feet. It's going to be in the places where hair does not grow. We also have epidermal ridges, which are just these invaginations into the dermis where the epidermis and the dermis come together, and those are what actually help to create our fingerprints. So they will be different on everybody. Keratinocytes are the things that are going to make keratin, and keratin is going to waterproof our skin. And then we have 5 layers of the epidermis. Stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. And they go in order from superficial to deep there. So we're going to start at the deepest layer of the epidermis, the stratum basale. It's also known as the stratum germinativum. It forms those epidermal ridges, those invaginations of the epidermis into the dermis, which are adjacent to the dermal papillae, which are kind of finger-like projections from the dermis that will match up with the puzzle pieces from the epidermis. The stratum basale has basal cells, which are also known as germinative cells, which are stem cells that help to regenerate our skin cells. There's also melanocytes, which produce melanin to give our skin its pigment. The There are also tactile or Merkel discs, which are a type of nerve receptor that detect touch. Moving more superficially, we have the stratum spinosum. Once stem cells are dividing in the stratum basale, they push daughter cells into the stratum spinosum. So you can think of the skin kind of regenerating itself from the bottom up. As those cells move toward the most superficial layer, they become shed. The stratum spinosum also has dendritic cells, also known as Langerhans cells. And the dendritic cells are a type of immune system cell. They help to defend against microorganisms and some superficial skin cancers. Moving into the stratum granulosum, it consists of 3 to 5 layers of keratinocytes, and it forms keratinohyaline. Keratinohyaline is a protein that helps to dehydrate the cell, and it helps to tighten those keratin fibers closer together. So it really helps to waterproof our skin. The stratum lucidum is only found in thick skin, so it's found in the palms and soles of the feet. It's usually found without organelles and filled with keratin. And lastly, we have stratum corneum, which is 15 to 30 layers of keratinized cells. The dead cells that are found here are usually shed in sheets because of those desmosomes that are holding those cells so closely together. They remain in this layer about 2 weeks after death, so at any point in time you have just a bunch of layers of dead skin cells just sitting on the surface of your skin. There is sebum, or that oil that's produced in your skin, and it helps to prevent bacterial growth and water loss. And as I've kind of alluded to, your skin is water resistant, not waterproof. And that's because you have insensible perspiration. You lose about 500 milliliters of water every day, and you never know. So insensible perspiration is your inability to feel your water loss. So it wouldn't be like you're sweating. Sensible perspiration is from when you can feel yourself sweating and losing water that way. Every minute you shed about 30,000 to 40,000 skin cells. So that results in about 9 pounds of skin lost per year. Pretty crazy. When the epidermis is damaged, blisters can form. Blisters are this fluid accumulation between the superficial and deep layers of the epidermis, or sometimes even deeper between the epidermis and the dermis. Xerosis is excessively dry skin, usually causes some dangerous fluid loss. And why do fingertips wrinkle when submerged in water for long periods of time? People used to think that was due to you losing that sebum or oil in your skin due to being in water for so long. The lipids just kind of go away. Recently, they found that the case is that the nervous system is actually telling your blood vessels at those layers of the skin to constrict, which results in this pruny-like appearance of your skin. And they think it's because your body wants you to be able to grip things better. So that's actually pretty interesting. There's also this factor called the epidermal growth factor. It's produced by the salivary glands and the duodenal glands, and I know what you're thinking. Why would the intestines be making epidermal growth factor? Why do they care about the skin? Well, originally they thought that this growth factor was only for the skin, and that's why it's called the epidermal growth factor, but actually it's for all epithelia. So the epidermal growth factor will promote the divisions of basal cells to kind of regenerate the skin, accelerates the production of keratin to get that skin water resistant. It stimulates epidermal development and repair, stimulates secretory product synthesis and secretion like sweat and sebum. And this is great research with skin grafts and burn victims. So they're actually able to use this factor to create whole sheets of skin to give to people who need skin grafts due to burns and areas of skin loss. So moving deeper from the epidermis, we have the dermis. There are 2 main layers of the dermis. There's the papillary layer and the reticular layer. The papillary layer is made up of areolar tissue. There's a lot of blood vessels and nerves here. And then the reticular layer has dense, irregular connective tissue and a lot of collagen fibers. If you have what's called dermatitis, there's a bunch of different types of dermatitis. It can be a very painful condition of an irritation of the dermis. It's typically in the papillary layer. The strength and elasticity of the dermis comes from the collagen fibers and elastic fibers. You can actually test the elasticity of the skin via skin turgor tests, where you pinch your knuckle at your finger. If it returns quickly back to your body, then you're not dehydrated. But if it kind of stays raised, then you're more dehydrated. Some factors that reduce elastin and therefore elasticity of the skin are aging, hormones, UV radiation, weight gain, and pregnancy, which is why you get those wrinkles and stretch marks, because where the skin was stretched there, it didn't really return back to its original place. There are some implications with tretinoin or retin A treatments. Vitamin A is really good for the skin and helping with elasticity. One really cool thing are these tension lines. So those collagen and elastic fibers in the skin are arranged in parallel bundles, creating these tension lines or cleavage lines. So surgeons know where all of these tension lines are in the body. So they make cuts that are parallel to these lines so that they will heal nicely and not scar. So this is especially useful for people who are cosmetic surgeons or plastic surgeons, so that they know how to cut in order to not create scarring. So with the dermis, it has a pretty large blood supply. There are arteries that lie within the subcutaneous layer of the skin and form plexuses in the dermis. So there's a cutaneous plexus that lies along the subcutaneous layer with the reticular layer of the dermis, and the subpapillary plexus that follows the contours of the epidermis and dermis border. Trauma will lead to bruises or contusions, which is just blood pooling in the dermis and leaving that black-blue color on your skin. Innervation of the skin, so as we said, it has a lot of innervation. There's a lot of sensory nerve fibers and receptors. It helps to control blood flow, adjust glandular secretion rates to what's needed for your body, and it helps to monitor sensory receptors. So we have tactile corpuscles or Mesner corpuscles that are for light touch, and lamellar corpuscles or Pacinian corpuscles, which are for deep touch and vibration. And then we have the subcutaneous layer, which is also known as the hypodermis. Like I said before, it's not considered part of the integument. It's deeper than that. It helps to stabilize the position of the skin relative to the adjacent tissues. It's composed of adipose tissue, so about 80% of all body fat is found in the subcutaneous layer of the skin. Pretty crazy. The superficial layer of the skin contains your arteries, and the superficial layer of the subcutaneous layer contains your arteries and veins. So, because there's not many capillaries here, it's a really great place for subcutaneous injections via this hypodermic needle. So that's why it's called a subcutaneous injection and a hypodermic needle, because it's going into the subcutaneous layer. So if you're going on to become nurses, this is the layer of the skin that you give those injections at. They tend to be more full of fat cells than they are blood vessels. So when you're thinking about the layers of the skin, think of the epidermis as the epithelial layer, and then the dermis and subcutaneous layers are both filled with connective tissue. They're connecting the epidermis to the rest of the body. So over time, with age, the distributions of the subcutaneous layer will change depending on the sex of the person. Infants have a large proportion of body fat when they're young. Infants have a large proportion of body fat because they need to insulate themselves. As adults, if you have a large amount of body fat around your midsection, that's called central adiposity, and that has a lot of implications with different chronic diseases, especially things like heart disease. And during puberty, Men tend to have more fat distributions in their neck, arms, lower back, and buttocks, and women tend to have more fat distribution in their breasts, buttocks, hips, and thighs. Now we're going into the pigments of the skin. Melanin is produced by melanocytes from the amino acid tyrosine, and they're packaged into these little structures called melanosomes. So it's not the amount of melanin that you have, but the amount of melanin synthesis that you have that determines your skin and hair color. So what is the rate in which you're producing melanin versus how much melanin do you have? That's what's going to determine the color of your skin and hair. So there are two main types of melanin pigment. There's pheomelanin that produces a red or yellow color, and then there's eumelanin that produces a brown or black color. So if you have blonde hair, you would have more pheomelanin. If you have darker hair, you have more eumelanin. There's also different parts of your body that have larger ratios of melanin production. The cheeks, the forehead, nipples, and genital region tend to have more melanin. Melanin helps to protect you from UV radiation. And UV radiation can bring about skin cancers and burns, so melanin protects you from both of those conditions. Albinism is a deficiency or absence in melanin production. Freckles are these hyperpigmented areas of melanin. Lentigos are similar, but they are larger patches. So this is an example of a lentigo. There's also senile lentigos or liver spots, age spots that will occur. Another pigment that we have is carotene. It's an orange-yellow pigment that accumulates in your epidermal cells. You might see it a lot if you have calluses. That's what the abundant pigment is there. It's found in your yellow and orange vegetables like squashes, pumpkins, and carrots. And if you eat a lot of those vegetables, your skin may actually take on the color of that as well. It's an important source of vitamin A, so it's really good for your eyesight. In your blood and in the circulation of that blood through your dermis. So hemoglobin helps to bind and transport oxygen in your bloodstream. And because of that high amount of circulation in the dermis, due to those plexuses that come from the subcutaneous layer, your skin flushes when your body temperature rises. So it gets more of a red pigment, and it becomes more pale when that blood supply is reduced. If you have a reduced amount of oxygen in general in your body, you will become cyanotic or have cyanosis, and this is a bluish type pigment in your fingers. You can also see this in your mucous membranes surrounding your eyes and your gums. Other diseases related to changes in skin color. We have jaundice, which changes your mucous membranes to a yellowish color. You'll see the sclera, the whites of your eyes turn more yellow. Also your gums. And this is usually due to a problem with the liver. Certain types of anemia can also lead to this, like hemolytic anemia. Tumors resulting in an increased production of melanocyte stimulating hormone will cause a darkening of the pigment of the skin. And Addison's disease is a condition related to the adrenal glands, and that will also cause a darkening of the pigment of the skin. Vitiligo is an autoimmune response to melanocytes, so your body starts attacking them, creating these white patches on your skin. Your skin, as we talked about at the beginning, synthesizes vitamin D. So it makes cholecalciferol, which is a type of vitamin D. It's vitamin D3. That's the first step in vitamin D production. The liver and kidneys are also involved, and they help to make calcitriol, which is a really important hormone for absorption of calcium and phosphorus. Cholecalciferol can also be absorbed in the diet, and that's really, really important because here in upstate New York or central New York or wherever you live in New York, we don't get a lot of sun. So the sun is what gives us our vitamin D from our skin, and since we can't make a lot, no matter how often you're outside, you need to make it in your diet as well. So egg yolks, fish oil, fortified milk, all great sources. You can also take vitamin D supplements if you're not into any of those listed food sources. There's a ton of different ways that you can get vitamin D in your diet as well, but those are really concentrated amounts. If you have a vitamin D deficiency as a child, you will get rickets. So you'll see a bowing of the legs. That's a hallmark symptom, although it's not super common, and it's not as common as they thought it was. So that's due to kind of the bones becoming less hard in nature. The equivalent in adults is osteomalacia, the overall softening of the bones, or osteopenia, which is a general weakening of the bones over time. Osteopenia is like early stage osteoporosis. And then we have skin cancer. Skin cancers can either be benign or malignant. Benign is good, malignant not so good. Actinic keratosis is a precancerous scaly area of the skin. This is really nice to know. If you can look a picture of this up so you know what it looks like. In your later adulthood, you might develop some of these, so it's really good to know before it develops into like a squamous cell carcinoma. Basal cell carcinoma is your most common skin cancer, usually found in areas of chronic UV exposure. So if you do a lot of tanning, or if you're outside a lot without sunscreen, or just outside a lot in general, because sometimes sunscreen isn't enough, but it definitely helps to protect you. Squamous cell carcinoma is almost entirely due to too much UV exposure. With basal cell and squamous cell carcinoma, there's about a 95% 5-year survival rate, so that's great. With malignant melanomas, if you don't catch it early, it has like a 99% 5-year survival rate. But if you don't catch it in time before it metastasizes, which it does really quickly, the survival rate is 14%, 5-year survival rate. So it's really important to know how to catch these melanomas, which we'll talk about on the next slide. But some ways to prevent these: avoid UV damage, don't tan, do spray tanning if you must, and wear sunscreen when you're outside so that you can protect yourself. Even on cloudy days, you can still have UV damage. So, detecting melanomas. Know your ABCDEs. A is asymmetry. So, if you're looking at a growth on your skin, whether it be a mole or a freckle that you think is kind of enlarging, make sure that it's symmetrical. It has even borders. Asymmetry is a bad sign. Get that looked at. So B is border. Your borders are even. Borders are uneven. Get that looked at. Color. It should be one color. If you have a mole that's multiple colors, get it looked at. D is for diameter, so it should be smaller than 1/4 of an inch. If it's larger than that, get it looked at. And E is evolving. So ordinary moles should not be changing in size, shape, or color. If it's changing in any of those, get it looked at. Worst case scenario, it's just an enlarging mole. But you need to be able to catch these things early. I know I'm like the CEO of Get It Looked At, but it's necessary. And when you have patients someday as a nurse and you're looking at things like their back that they can't see, maybe they'll have one of these, or maybe they'll have a basal cell carcinoma, and you need to be able to recognize them so that you can have a dermatologist or a doctor in general just look at it to see if it's melanoma and get it treated. So next week we'll dive into accessory structures in the integument,